In this podcast episode, the host engages in a comprehensive discussion with lipidologist Tom Dayspring about the intricacies of cardiovascular disease, its risk factors, biomarkers, and the role of Apolipoprotein B. The conversation delves into the pathophysiology of atherosclerosis, the significance of cholesterol in the brain, and the future of cardiovascular medicine. Atherosclerotic cardiovascular disease, ASCVD, is recognized as the leading cause of death globally. Dayspring explains that ASCVD is characterized by the deposition of cholesterol in the arterial walls, leading to a pathological condition that can result in heart attacks and strokes. The discussion emphasizes that this process is gradual, taking decades to develop, and is influenced by various risk factors, including age, smoking, lipid disorders, and hypertension. The accumulation of cholesterol in the arteries can lead to plaque formation, which can either narrow the arteries or rupture, causing acute cardiovascular events. Dayspring highlights that the arteries supplying the heart and brain are particularly vulnerable due to their small size. The narrowing of these arteries can lead to ischemia, where the tissues do not receive enough oxygen. The conversation underscores the importance of understanding the timeline of atherosclerosis, which begins early in life, often in childhood, and progresses silently until significant damage occurs. This long-term perspective on cardiovascular health is crucial for effective prevention and intervention strategies. Apolipoprotein B, ApoB, is a key player in lipid metabolism and is essential for understanding cardiovascular risk. Dayspring explains that ApoB is the primary protein component of atherogenic lipoproteins, including low-density lipoproteins, LDL, and very low-density lipoproteins, VLDL. Each ApoB-containing particle is capable of entering the arterial wall, making it a critical marker for assessing cardiovascular risk. Unlike traditional cholesterol measurements, which can be misleading, measuring ApoB provides a more accurate reflection of the number of atherogenic particles in circulation. The discussion emphasizes that the focus on ApoB is shifting the paradigm in cardiovascular risk assessment. Dayspring argues that measuring ApoB and triglycerides should be the cornerstone of lipid testing, as these markers provide a clearer picture of an individual's risk for developing atherosclerosis. The conversation also touches on the importance of understanding the relationship between ApoB and other lipoproteins, such as lipoprotein A, which can further complicate cardiovascular risk profiles. The pathophysiology of atherosclerosis is complex and multifaceted. Dayspring describes how the process begins with the infiltration of LDL particles into the arterial wall, where they become oxidized and trigger an inflammatory response. This response recruits immune cells, such as macrophages, which engulf the oxidized LDL and transform into foam cells. Over time, the accumulation of foam cells leads to the formation of plaques that can obstruct blood flow or rupture, resulting in acute cardiovascular events. Dayspring emphasizes that atherosclerosis is not merely a consequence of high cholesterol levels. Rather, it is a dynamic process influenced by various factors, including inflammation, oxidative stress, and endothelial dysfunction. The conversation highlights the importance of understanding these underlying mechanisms to develop effective prevention and treatment strategies for cardiovascular disease. The discussion on risk factors for cardiovascular disease is extensive, with Dayspring outlining both modifiable and non-modifiable factors. Non-modifiable risk factors include age and genetic predisposition, while modifiable factors encompass lifestyle choices such as smoking, diet, and physical activity. Dayspring stresses the importance of addressing these modifiable risk factors to reduce the overall burden of cardiovascular disease. Dayspring also discusses the role of insulin resistance and chronic kidney disease as significant contributors to cardiovascular risk. He explains that insulin resistance is often associated with dyslipidemia, characterized by elevated triglycerides and small, dense LDL particles. Chronic kidney disease, on the other hand, can lead to a buildup of uremic toxins that further exacerbate cardiovascular risk. The conversation underscores the need for a comprehensive approach to risk assessment and management, taking into account the interplay of various factors. The role of cholesterol in brain health is a fascinating aspect of the discussion. Dayspring explains that cholesterol is a vital component of neuronal membranes and is essential for proper brain function. The brain synthesizes its own cholesterol, and this process is crucial for maintaining neuronal integrity and function. However, an imbalance in cholesterol levels can contribute to neurodegenerative diseases, including Alzheimer's disease. Dayspring highlights the importance of understanding the relationship between cholesterol metabolism and cognitive function. He discusses how Apolipoprotein E, ApoE, plays a critical role in transporting cholesterol within the brain and how different isoforms of ApoE can influence the risk of developing Alzheimer's disease. The conversation emphasizes the need for further research to elucidate the complex interactions between cholesterol, ApoE, and brain health. Looking ahead, Dayspring expresses optimism about the future of cardiovascular medicine. He highlights the advancements in lipid-lowering therapies, including new classes of medications that target ApoB and other atherogenic particles. These developments offer the potential for more effective management of cardiovascular risk, particularly for individuals with genetic predispositions to dyslipidemia. Dayspring also discusses the importance of personalized medicine in cardiovascular care. As our understanding of lipid metabolism and cardiovascular risk factors continues to evolve, there is a growing emphasis on tailoring treatment strategies to individual patients. This approach not only improves outcomes, but also enhances patient engagement and adherence to treatment plans. The conversation underscores the significance of early detection in preventing cardiovascular disease. Dayspring emphasizes that atherosclerosis begins in childhood, and identifying risk factors early can lead to more effective interventions. He advocates for routine lipid screening in children and adolescents to assess their cardiovascular risk and implement preventive measures. Dayspring also discusses the role of advanced imaging techniques in detecting early signs of atherosclerosis. While traditional methods may not reveal significant changes until later stages of the disease, newer imaging modalities can provide valuable insights into arterial health. The conversation highlights the need for continued research and innovation in this area to improve early detection and intervention strategies. Inflammation is a central theme in the discussion of cardiovascular disease. Dayspring explains that chronic inflammation plays a significant role in the development and progression of atherosclerosis. He discusses various inflammatory markers, such as C-reactive protein, CRP, and their association with cardiovascular risk. However, he cautions that these markers should not be viewed in isolation, but rather in conjunction with other risk factors. Dayspring emphasizes the importance of addressing inflammation as part of a comprehensive approach to cardiovascular health. He discusses potential therapeutic strategies aimed at reducing inflammation, including lifestyle modifications and pharmacological interventions. The conversation highlights the need for a multifaceted approach to managing cardiovascular risk, considering both lipid levels and inflammatory processes. The discussion on lifestyle factors is a crucial aspect of cardiovascular disease prevention. Dayspring emphasizes the importance of a healthy diet, regular physical activity, and smoking cessation in reducing cardiovascular risk. He discusses the role of dietary fats, particularly saturated fats, in influencing lipid levels and overall cardiovascular health. Dayspring also highlights the significance of weight management and its impact on insulin resistance and lipid metabolism. He advocates for a holistic approach to lifestyle modifications, encouraging individuals to adopt sustainable changes that promote long-term cardiovascular health. The conversation underscores the importance of patient education and support in facilitating these lifestyle changes. As the conversation progresses, Dayspring expresses excitement about the future of lipid testing. He discusses the potential for new biomarkers and advanced testing methods to provide more accurate assessments of cardiovascular risk. The development of tests that measure ApoB and other atherogenic particles is a significant advancement in the field. Dayspring also emphasizes the need for increased awareness and education among healthcare providers regarding lipid testing and interpretation. He advocates for a shift in focus from traditional cholesterol measurements to a more comprehensive understanding of lipid profiles and their implications for cardiovascular health.